Hello everybody, this is Werner Fehn from Bone Monitor. I'm the CEO of this company. It's a pleasure to meet, to introduce you and give you a live demo into our Lyosis software, which makes fracture management easier. So principle-wise, the Lyosis software is part of the CTF program. It's one of the 5 pillars in the CTF program, and here we come. So with the policy, with the coalition, the mentorship, and the scalable solutions, is Lyosis the 5th pillar in this program, which is called there the digital tool. So Lyosis is a browser-based in-house service which is running in the FLS centers to help doctors, nurses, and all the staff to manage and work all processes more effectively. We have a KPI dashboard to measure and optimize the associated processes and track performance, to optimize workflow, to reduce administration overhead and double work. It will significantly reduce cost of human resources or even spare a lot of time, of your time. So the tool will be run in your hospital, and this will keep all patient data in your house. In this live demo and even on the live demo, you can test by yourself in the cloud. There are only random data. So keep in mind that these are not real data, and even some of the resulting pages or reports may be nonsense, as these are not real data. So as a summary, I can say that the digital tool is a user-friendly software to enable FLS efficiency, provide continuity of care, manage patients more effectively, improve clinical outcomes, and reduce medical and healthcare costs. As I said at the end of the demo, there's enough time for your question, but anyway, if you have questions later, you can contact me here. So first of all, you have to open a browser and go to the software and log in. What you see here after login is the so-called the dashboard. And the dashboard has different sections, like a picture of your hospital, maybe a logo of your hospital, which is the IOF logo right now. But this can be adapted, as well as date and time and some words about your hospital. We have here a task list. That means open tasks to do, maybe for a nurse or for the doctor or for the administrator of the software. And you can filter that by the tasks you have to fulfill by today, or the next 7 days, maybe all hide or unhide the already done tasks. Typically, you hide the done tasks because they are done, nothing more to do. And you can print out the result in terms of this list, or export to an Excel file in terms of these lists. On this section here, you can see later the KPIs sections, settings of the software, and for sure you can log out and log in again here. If you click to the Lyosis icon, then you every time come back to this dashboard. So wherever you are, just click top left and you are coming back. Here you can search for patients or add patients. Right now we have 211 random patients in the database. Okay, let's start. So typically you are logging in and see your all open tasks. For example, for this patient, there's a monitoring needed, which is called monitoring 16 weeks. So typically after 16 or 52 weeks, they should be monitored. The number of weeks is configurable. You even can drive down to 1 monitoring or 3 monitorings or whatever you like, and add monitoring data to the database. But before we go into this detail, just click on the patient here. And then you can see here on the left side a menu which is always related to the patient. So all data, when you have clicked on the patient and the menu on the left side is opened, then everything you can see here is related to the patient and to the task related to what you have to do. If you see the total task list, then you see every task you have to do, but you see all different patients. But coming back to the patient here, we see this menu which is showing the patient data only. And this menu has 4 sections: administrative, so basic information about the patient; clinical content, everything which is from clinical point of view important; letters, which means automatic generated letters; and open tasks related to this patient and related to you as a user. So let's go into more detail here. So open the administrative page. You can see here patient information, a submenu, patient information, primary care physician, contact for monitoring, and insurance coverage. Yeah, let's click to the first submenu. Then you can see a form here, and this form holds all the administrative information. So you can scroll down here or just jump to the section by clicking on the submenu here. It's the same. So clicking here or just go up, scroll up and down here. So for the patient information, to give you an example, you can collect a lot of patient data like date of birth, patient ID, sex, language, first name, last name, his address, different mobile, different telephone numbers, and the country he's coming from and language he is speaking. If we scroll down, you see contact information for the primary care physician, which is important for the letters, for the automatic generated letters for this contact, or contact for monitoring. So this could be the patient itself, or maybe a relative, like husband, or a friend, or whoever. And you can even collect the insurance coverage with some insurance information about the patient. Okay, coming to the next section, which is the clinical content. It's a huge form or different form with a huge number of data. And we have a submenu, another submenu here, which is the clinical assessment or the bone density results, laboratory test results, other medications, treatment recommendation, and as already mentioned, the monitoring of these patients. So going to clinical assessment. Another submenu opens here, and it's the same as I have shown you, demonstrated you on the administrative page, that you can click here and go into the different sections, or just scroll up and scroll down here. So let's start with the index fracture, and you can add a date of assessment, date of diagnosis. Is it a hip or not a hip? Is it a spine or not? You can add other fractures here, type of fracture, and a lot of other information. You see that some of the fields has this orange frame, and others don't have that. And it's very simple to explain. The orange frames are mandatory data, because these data are used for monitoring or for automatic letter generation and so on. So you can add a patient or you can edit a patient every time. You can close the form without having all the mandatory data ready. You can save them, but you cannot generate letters before you have added all the mandatory fields. And as long as you don't have all the mandatory fields filled out, you can see an open task for you that for this patient, like this one here, you have to complete the patient's clinical data or other informations. If you have filled in all the mandatory data, then this task will be automatically deleted from the database, or let's say closed. So going back to a patient, we have bone density results here, date of DXA, which machine is used, and all this other information and results here. Laboratory test results, core test, additional test, and all this information you need to have on hand in your FLS center. For the laboratory test results, another submenu opens, like this one. And as already mentioned, you can access it by using the submenus or just scrolling down. Like other medication and allergies, treatment recommendation, and here the monitoring results, like is the invitation sent out, is it already monitored, contacted but declined, or maybe patient died, and other information about the monitoring. So closing the clinical content here. Coming to the letters, as I already mentioned, there are several automatic generated letters in the system, and you can see here the type of letters, like did not attend, or invitation to an DXA, invitation to FLS assessment, monitoring outcomes, and so on and so on. And for every type of these letters, you can create drafts or edit drafts. You can create a new one, or just edit an existing one. So in this case, I have a draft one, and I can easily edit this letter here, and the letter will be filled out by a template which comes from the software itself, but it can be adapted to your belongings, and it will be automatically filled out by with your logo, with the patient name, with the FLS center name, which will be part of the software setup while installation. But also all the rest can be easily changed by you by changing an HTML template. So to give you an example, as I said, there must be filled in some of the mandatory data before you can generate a letter. And for example, some of this data are missing. For example, the rescheduled appointment date and time, and some other placeholders, which will be automatically generated or automatically filled out by the software itself as soon as you has input the data, the missing data in the database of the patient. So you can edit it if you like, and save this version as a draft, or later on you can finalize it. So maybe it's not allowed to finalize a letter by everybody in the hospital. Maybe it's only allowed for some people to save drafts and for other people to finalize letters. this is related to roles and rights management, which I want to show you later. Okay. For all this type of letters here, you can create new letters, you can create drafts, you can edit drafts, you can send it, or you can finalize and send it later. So coming to the last section of the patient database, and for this patient, which is this one here, you see all the open tasks, and again, red means they are overdue and green means you are in time. For the next 7 days, nothing to do. If you go to all, you see everything, and even not something to do for today. Okay. Going back to the dashboard, you can also search for patients like this one, or this one. And if you are on the search bar, then this will be not longer a open task list. This will be a result page or result section of your search. And again, you can print it out or export to an Excel file. Another thing you can do here is adding a patient. And if you want to add a patient, you are coming to the same menu structure as you have seen before, but some of these items are not open to click, because before you can see the rest, you have to put in the only one mandatory data, which is the patient ID. You can input more, but the only mandatory data so far is the patient ID, and then you can proceed with other data and fulfill or fill in all the rest of the data later. Users are connected to roles. That means this user has the role of a administrator IT, which you name administrator IT, and this role has a right, different rights in the software. And what rights he has, you can easily see here if you click to permissions. So here it becomes more transparent what I'm speaking about, and you can see here the different roles like IT administrator, FLS administrator, a doctor, a nurse, all the test role. I just added this role, and every new role has no rights. And in this list you can see what rights I'm speaking about. For example, to manage users perhaps is allowed for IT administrators, for FLS administrators, maybe for nurses, but not for doctors in this case, and maybe also for our new role, which is called test role. So, and here you can edit who is allowed to view patients, who's allowed to search patients, who's allowed to export patients, who's allowed to add patients. For example, to add patients is allowed to nurses, doctors, FLS administrators, and IT administrators. And who is a nurse or doctor or FLS administrator is defined in the user settings, as I have shown you just before. Yeah, to give you a summary, the right management is using roles, so it's based on roles. The rights are connected to different roles, and the users of the software are connected also to the roles. That means if you want to add a nurse, then you just have to add name of this nurse and say this user is a nurse, and then everything is clear what this nurse is allowed to do or not allowed to do. So where it makes sense, perhaps at the letters, somebody is allowed to edit a draft, another one is allowed to finalize the data, and another one is maybe allowed to send it out. And you can see all these rights here, like user management, patient management, letter management, task lists, and settings. Now, for example, here you can import patient, and this probably should be only allowed to an IT administrator. The last thing I want to show you is the KPI sections. Going back to the dashboard first, and then you can see here the KPIs. So KPIs are key performance indicators which help you to manage your FLS center more efficient, more effective, and drive down the costs as well. And even as to optimize medication and other things. All these KPIs are defined by University of Oxford, and you can find a very detailed explanation of all these KPIs in the resource center of the CTF program. Just to give you an example, right now we have 10 KPIs in the software. We want to add more and more KPIs in the near future, but right now we have this 10. And for example, number 4, time to DXA within 12 weeks. And you can see the percentage of patients which has done the DXA in a dedicated time. Now, as I said, this data makes no sense because they are random data, but you can also find a brief explanation with some sources or references of this KPI below the chart. Yeah. And these KPIs will effectively help you to optimize workflow and drive down costs in your FLS center. And for sure, the KPI section should be not visible for everybody, and therefore this is part of the right management. For example, Dr. Leonard McCoy is allowed to visit to show the KPIs. Maybe another role or another person is not allowed, and only for people or for users which are allowed to show the KPIs, this icon is visible. Otherwise, it's not visible here. Yeah, okay. I think my demonstration is done now. I'm very happy to receive your questions. Thank you very much for watching.